So first of all, I would like to invite Dr. Sai Kiran sir here on this platform. Sir, could you please take over and share the information about the infection control practices that we need to practice? Sir, thank you.
Thank you, Snehalata. And at the outset, I would like to thank NNF UNICEF for this opportunity. A very good afternoon to all the attendees. While I start my screen sharing, here we go. Is it visible? My screen is visible?
Yes, sir. We can see your screen, sir. Yes, it's visible.
Thank you. Thank you. So I think today, as we have this session on neonatal infection prevention and control, most of us working in the NICU would agree that infections are the major killer in the newborn babies. And there is a worldwide problem of neonatal infections or hospital-acquired infections in general. The basic tenet of any medical care, and we all have taken the Hippocrates oath, is do no harm. So infection prevention, especially the hospital-acquired infection prevention, is the basic fundamental right of every patient. So we should have a zero tolerance towards any neonatal hospital-acquired infections. So in today's brief talk, I would take you through a few definitions. We will look at what are the burden and the risk factors of hospital-acquired infections, what are the different types which we encounter in newborn, and the core principal practices of infection prevention. At the end, time permitting, we will see some videos for sure, but all the links I will share with you, which you can watch at your leisure, and we can share with your team members also. So what are basically neonatal infections? And in an earlier webinar, you would have learned that essentially the neonatal infections can be early onset, that is within the first 72 hours of life. And these infections are acquired from the mothers to the baby in the birth canal. So whenever we have an unclean setting for the delivery, a mother with chorioamnitis, repeated pervaginal unclean examinations, prolonged labor, that leads to an infection in the baby. The late onset one is typically what we also consider in the hospital-acquired infection. Here, the infection manifests in the baby after 72 hours of life, and it is essentially from the caregivers and the surrounding environment. At the community level, it can happen again with a dirty environment, with an unclean skin and cord practices. And whenever the baby is deprived of the breast milk feeding, because the breast milk is the first vaccine of the newborn. So we have to understand what is a hospital-acquired infection. To put it in a simple words, it is an infection that occurs at any site after the patient or the baby is hospitalized. That is, the organism is inoculated or enters into the body of the patient or the baby after hospitalization. It was not present before or neither was incubating at the time of admission. So typically any infection that starts on or after the third day of admission, and in case of a newborn after third day of life, after birth in a hospital, is typically a hospital-acquired infection. In our setting, both early onset and late onset sepsis are like a hospital-acquired infection. As we just discussed, an early onset sepsis is a vertical transmission. So if we have a birth of a baby happening in unclean settings, in a labor ward where enough of asepsis is not there, definitely it's a type of a hospital-acquired infection. And here I'm not talking about the non-institutional births. So majority of the talk today will be on how do we prevent this type of infection. Well, how common is it? I was reading somewhere that if somebody has to compare that the chances of dying in Iraq or Afghanistan is less than the chances of dying in a hospital after getting admitted. That is, hospital-acquired infections killing patients is more common. And this data I'm talking about is in US. So if I was standing in Iraq, a bomb killing me will be less than the risk of dying in a hospital from hospital-acquired infection. Definitely an under-recognized phenomena. How to define it is itself something which is very confusing. So definitely we have not much of data. In one such study from India a couple of years back, in the neonatal population, some 14,000 babies were studied across the public sector hospitals in Delhi, there was an overall incidence of close to 15%, and nearly 7% were blood culture positive. And this number can vary. But what we know is whenever there is a hospital-acquired infection in newborn, it increases the mortality. Definitely the interventions and the length of hospital stay, so is the cost, and more importantly, the long-term problems. An infection like meningitis will definitely have an impact on the growth of the baby, which in turn will hamper his or her long-term neurodevelopment. That in terms it leads to long-term quality of life impairment. So this is a burning problem, and definitely it is something which each one of us encounters in our clinical practice. So to understand that how infection comes to the baby, we have to look at the bug. Now, bacteria or the viruses, they have been there before even the humans evolved. In fact, we have been a late entry on this planet. So in the evolution cycle, the bacteria shared this earth before than us. So we cannot eliminate them. But what we can do is we can make sure that they're not problematic to our patients and the babies. So let us see through some pictures that how the bug or the bacteria travels and gets ultimately into the baby. Now here we see that I will use pointer. Yeah. So this is my entry to the NICU, and each day when each one of us walks, or sometimes from patients, we carry the bacteria. The most commonly it is we, the healthcare workers, who have the bacteria with us on our hands from our community. We enter into the NICU, and when we enter, we carry the bacteria. What do the bacteria do? They find a soft spot. What do bacteria like? They like a dark corner, wet areas. So whenever you have an NICU or hospital corner where you don't have ventilation, or where there is humidity, where there is seepages, wet places like the wash basins or the sinks, or suction areas, like in this hospital we are seeing in the background that there are the suction areas, or in near the pipes which we are seeing here. So at these places the bacteria tends to proliferate, and these soft corners for the bacteria helps them to flourish on the floors, on the walls, on the surroundings. And from there, the surroundings of the baby, that is, suppose in this case, the bed surrounding the area, that is the syringe pump, infusion pump, they start residing there. Now, the problem comes when this bacteria lands on the baby, and that is essentially from the hands of the healthcare worker. So the hands which were around surrounding, so just few moments back, the alarm of the syringe pump was muted, and now it is touching the blender, and in some moment it will touch the baby. So the hands carry this infection, and when it lands on the baby, it starts proliferating on the baby's skin. And skin, wherever it is broken, whether it is because of an IV line or it is because of a skin injury, the bacteria starts entering into the baby. So it is just waiting the portal for entry. And what are these portal for entry? IV lines, skin background, the OG tubes, endotracheal tubes. And when the bacteria which is there in the surrounding and on the hands of the healthcare lands on the baby, that is called as colonization. And when this bacteria enters into the baby, that is called as inoculation or infection. And once it enters and proliferates in the baby, then this infection leads to sepsis and the manifestations of the sepsis. So what we normally see is that once one baby is infected, it starts spreading from one baby to another baby, again by the hands of the healthcare workers. And this especially is true when we have many babies who are just nearby, not enough spacing. And if we are seeing one baby infected, the infection starts spreading. So this is how the organism tends to be there in the immediate environment on the baby, and then keeps percolating inside the NICU environment. If we understand this basic life cycle of the bug, we then understand what are the different opportunities whereby we can prevent or arrest the cycle of the spread. So in the subsequent slides of today's presentation, I would like to highlight upon this. So let us see what, I'm just sorry, I jumped a slide. Yeah, so much of the discussion which I had was about the role of the hands. That is, we all carry the germs in the hands, both in the community and in the hospital setting. And usually the organisms which are there on the hands, they tend to survive for good number of minutes. So whenever we touch a patient or whenever there's an infected baby, the germs from that baby are transferred to our hand. Now from these hands, they can be transferred to the surrounding surfaces or the articles or the next patient. So it is very important that we recognize that it is the hands which are the culprits in the spread of the organisms. So now what are the organisms which cause the infection? So from this study from our country and from Southeast Asia, when we look at the common bugs which are responsible for this neonatal hospital acquired infections or neonatal infection hospital setting are the gram negatives like the Klebsiella and the E. coli. And Klebsiella and the E. coli are the organisms which are in the gut or in the GIT tract, and from there in the hands. So hands are again the culprit. Then there are bugs like Pseudomonas and Acinetobacter. These are found in the soil, in the environment. So whenever there is an NICU where there is lot of unhygiene and there is lot of moisture or sometimes construction activity happening, there these organisms survive. They're basically the soil organisms, whereas Klebsiella E. coli are the gut organisms. These are the environment. And then we have the Staph aureus, very common in most of the individuals in the population. We have carriers who have this Staph aureus in the nose, and from the nose to the hands, and then it spreads. The problem is majority of these infection causing organisms in the community are now resistant to most of the common antibiotics of cephalosporin series, leave alone ampicillin, gentamicin. That means they are difficult to treat. So they are very common. These organisms, where they originate, we know, and most importantly, they are difficult to treat. So with this background, we have to understand that where all they cause infections. So when we look at the sites of infection, when a bug that is on the baby invades the baby and enters into the blood, it is called as bloodstream infection. A bloodstream infection that is because of an IV device is called as a IV device associated, and when you have an umbilical line or other central lines, it is called as CLABSI. So this term you will frequently hear in most of the literature saying that CLABSI is the most common form of neonatal infections acquired in the hospital. Then second, when the bacteria enters into the respiratory tract, it sets the pneumonia. This is commonly seen whenever the baby is on respiratory support, especially invasive respiratory support. When you have an endotracheal tube into the trachea, the bacteria travels across the device and goes into the lungs. And other common infections are of the skin and the soft tissues, like the pustules you see on the skin and near the umbilicus, the eye infections. Again, these are some set of infections. The other type of infections which we see less likely, urinary tract infections, catheterization whenever there is it puts a risk for the portal of entry into the urinary tract. CNS infections could be definitely a complication of the bloodstream infection, that is meningitis. And in the units where their surgeries are done, surgical site or the stitch site infections are very common. But the three most common infections encountered in the NICU population is the bloodstream, pneumonia, and the infection of skin and the soft tissues. So with this basic understanding of the risk, with the etiology and the type of infection, now who are the babies who are at risk? Generally, all the neonates have an immature immune system, which we just had highlighted in the previous webinars, and this puts the baby at risk of, biologically at risk of infection. Smaller the baby, lesser the gestational age, lesser the birth weight, more is the risk of infection. Comorbidities like certain congenital malformations or congenital conditions, birth asphyxia, they increase the risk of the infection. Then whenever the baby is in the hospital care setting, our intensive care stay, invasive medical devices like OG tube, the endotracheal tube, IV cannulas, umbilical lines, they all facilitate the entry of the bacteria from baby's skin and the surroundings into the body. So any baby on IV fluids, invasive devices. Similarly, any baby who is has a more prolonged NICU stay, as the duration increases, so is the chances of infection increase. And any baby who is started on an antimicrobial can have secondary infections. Like you put the baby on an antibiotic, then because of that, they can have secondary infections like by fungus. So these are some care related. Now, having looked at these two, then there are some modifiable risk factors. Now, biologically, the risk factors we cannot mitigate directly. Some caregiving practices, when we act upon them, we decrease the risk. But most importantly, the three most important risk factors which can decrease the chances of infection are lack of hand hygiene, I mean, enough hand hygiene or good hand hygiene, avoiding crowding, and proper asepsis or avoiding contamination of IV fluids and feeds. So if you have a crowded NICU, if you have less number of staff to take care of the babies, if your environment is not clean, and if you contaminate the feed and the fluid, definitely the infections increase. And if you look at these three factors together with less invasive care, half of our infections will come down. So all this we'll just see in the next few slides, and definitely prevention is always easy than any cure. So with one single slide, we understand that how it is easy to prevent. And again, I will come back to understand these prevention factors by the help of the same diagram. Now let us suppose if you look at the entry, if I don't allow the organism to enter the NICU, what should I do? I should make sure that all the people who are necessary for the baby care, the doctors, the staff, the parents, they only enter. I should make sure that unnecessary people don't enter. I should locate in such a way that the surrounding of the NICU is clean. So it depends where the NICU is located. If you're in just besides a busy OPD, there is a lot of people coming in and around. If I have to reach one corner of the hospital through the NICU, definitely the number of organisms which are entering the NICU with the people will increase. So the NICU design matters. Together with this, whenever I enter the NICU, I should make sure that I don't carry the organisms inside. So for that, I have to clean my hands, and that is the concept of hand hygiene. Now let us suppose when it is carried into the NICU, I should make sure that I should not give a favorable condition for the bacteria to grow. So I should keep the environment clean. We should have a well-ventilated, lighted, spacious NICU. There's no dark and wet corners, and enough place is there to do the cleaning practices. Then I should make sure that when I am doing the baby care, I should not give any bacteria to the baby. I should not inoculate the baby. I should not put the bacteria on the baby. And for that, again, I have to clean my hands. So again, it is hand hygiene. And then I should make sure that the bacteria which is reaching the baby should not go into the baby. So for that, I have to make sure that skin, which is a first line of defense, which is a barrier against infection, is good of the baby. And wherever possible, I will not do invasive wherever possible. And if I have to do, I have to do it in a proper methodical way. So that is called as good care practices and skin care. And then if unfortunately a baby is infected, I have to make sure that from that baby it doesn't spread to the next baby. For that, I have to ensure that I am not overcrowding my place, and I have again good hand hygiene. So the recurring concept of all the care is hand hygiene. So when you look at prevention as a model for to prevent infection, if you look at it as a model, we can divide it into three sections. The hygiene of the hand is the core and the single most important aspect. We understood the role of the hands. Then we have to look at the care practices. Then when you give clinical care, we call something as aseptic non-touch technique, which will just come. But it is nothing but making sure that your procedure is safe and not making the baby prone to infection. Proper skin care presents the baby against a good defense against the infections, and make sure that whatever you are feeding or giving IV fluids and injections should not be contaminated. Just remember this much, that good hand hygiene with good care practices and doing good skin care and avoiding contamination of the fluid decreases the burden of infection. The other aspect of keeping the environment clean and doing proper waste management is called housekeeping. And next week you will have a webinar by Dr. Sriram on housekeeping, where he will cover that how we can decrease the burden of the load of the organisms in the NICU by proper cleaning practices. So today I will focus on hygiene and the care practices, that's hand hygiene and care practices. So what is, I think I lost the photograph. I'll just take a few moments. I just lost the photograph here. I don't know. Sorry for the interpret. I think the pictures were missing. I will just try to reshare because it is very essential. I'm sorry for the interruption. You're able to see the picture now? Yeah. So it is very important to understand.
We
Sorry.
can see your file folder.
You can see the file folder.
So, yes, we can see it right now.
Okay,
yes, sir.
Okay. I don't know. Something goes wrong. Sorry for the technical glitch.
That's all right, sir.
Yeah.
Please go ahead.
So that brings us to what are the 5 moments of hand hygiene. If there is one mantra which is very important for any setting in the hospital, be it ICU, non-ICU, NICU, or wherever we are, this is the 5 moments of hand hygiene. We just understood the role of the hands. That is, we carry the bugs on the hands. We pick from one surface, one baby or one patient, and transfer it to the another baby or surrounding articles. So our entire aim is to keep the baby in the center safe and make sure that we create a barrier whereby no bacteria lands on the baby. So what should we do? We should ensure that the hands are clean before touching the patient. After we touch the patient, again I have to make sure that the hands are clean. And in between, if I am doing any procedure before, like feeding the baby or sometimes doing procedures like putting a cannula, I should ensure. So the sequence is before touching, before performing any procedure, changing the nappy where you tend to get exposed to the baby's body fluids, or feeding when you might get exposed to the baby's saliva. And after touching the patient, you should ensure that you clean the hands. Before touching, no bacteria lands on the baby. Before doing any procedure, you ensure that no bacteria enters into the body of the baby. After getting exposed, because the body fluids can carry a lot of organisms, you disinfect your hands. And definitely before completing the baby, after completing the baby care, before going to the next patient, you clean the hands. And not only the baby, the immediate surroundings of the baby, where we saw that the bacteria are there, like the monitors, the syringe pump, infusion pump. When you touch that also, it is important. So we should ensure that whenever these 5 moments are happening, we should have clean hands. And how to achieve this clean hand concept is what is hand hygiene. So this one small picture from WHO beautifully says everything, that it is important to perform 5 moments of hand hygiene, especially when the hands are dirty, after we go to a toilet, and when we enter into the ICU hospital or the NICU. Now, this is just a reference, but more importantly, what we have to understand to perform hand hygiene is there are 2 methods. One is hand wash, where you use soap and water. And we will see in the skill video that how to perform a proper hand hygiene, and it is more of a practice. You have photographs which are easily available, but what is important is when to perform what. So whenever you are entering the NICU, after going to a toilet, or when the hands are soiled with secretions, you should ensure that you wash your hand for 40 to 60 seconds with soap and water. Then there is alcohol-based hand rub. These are nothing but the sterilium and other products which you will be using. They are easy to use. So what people have found is that using alcohol-based hand rub, it was easy. And thankful to the COVID pandemic, at least one thing is that people have realized how to use a sanitizer. Previously, we had to tell what is a sanitizer. Now everyone knows. In fact, mothers themselves carry in their pocket. That is nothing but you have an alcohol agent which cleans the hands, kills the bacteria on the hands every time when those 5 moments are going to happen. So you can achieve hand hygiene. Hygiene is nothing but making your hands disinfected to such an extent that they don't carry infection to the baby. This can be achieved with hand wash with soap and water in the settings when you enter the hospital, or when they are visibly soiled with secretions or dirty. Then you have alcohol based, when you are performing the common 5 moments, that is before touching, before performing any procedure, after coming in contact with the body fluids after completing the baby examination or surrounding the touching like silencing and alarm. So this hand hygiene methods, which we'll see in the skill video, but it is not just the use of the soap, water, and the alcohol-based hand rub, but more importantly, how you take care of the hands. So you should ensure that we don't carry jewelries like the rings and wristwatches. We should not have long nails, definitely no artificial nails and nail polish. And always, if there is any visible skin cuts, one should ensure that they are with a waterproof dressings. If our skin is very dry, irritated, and cracked, it will carry a lot of bacteria. So good skincare also involves keeping your skin soft, moist, without any major cuts. So one of the important thing is what products you use for your hand hygiene, because if there are very harsh products, sometimes they damage the skin. So there are some aspects of this which we are highlighted in this WHO hand hygiene, and when I share the presentation, you can keep with you. It just talks about this, that when to do with soap and water, when to do with alcohol based, the 5 moments you should know, and the agent which you use. So whichever NICU, whichever SNCU you are working, ensure that you spend enough on getting a good. So never compromise on the quality of hand hygiene product, that is the soap or the alcohol based. They should have low irritancy potential, and that is, some soap solutions and some hand hygiene products are very irritating, or they smell very bad. They have some fragrance, but they are repulsive. So ensure that it's a good quality product, and it should not be allergic. So this is important concept of the hand hygiene. Then many of us think that, can we wear a glove? Is glove good? Many of you would have seen in your cities and places that you have this pani puri wala wearing that glove and then feeding everyone. That is only for our satisfaction. With the same glove, he will touch everywhere and put that pani puri in your plate. He will also touch his hair. So gloves are not a replacement for clean hands. Many people think that wearing gloves, I can do all the things, but never. You have certain indication of gloves, like your sterile gloves are meant for some invasive procedures, like if I have to put a cannula or do a procedure, I have to wear sterile gloves. Non-sterile gloves, whenever these non-sterile gloves are also those paper gloves, which we call as the hand safe, which is available various companies and various makes. But whenever you are going to have an exposure to body fluid or contaminated environment, you can use them, but not for invasive procedures. So these are two set of gloves. But what is important is, even if you are going to put gloves, before that you have to perform hand hygiene, whether it is with hand alcohol-based hand rub or with soap and water. And more importantly, after you remove the gloves, again you have to perform the hand hygiene. So gloves are for the personal safety, but they don't, and also for decreasing infection, but they don't guarantee. And there is no replacement for the clean hand. So always remember this aspect of the hand hygiene. Now we know that hand hygiene, understanding that how the infection is spreading, how hand hygiene is important. But various literature and studies in the hospital setting have shown that people tend to not do, intentionally not, but unintentionally, the hand hygiene is not performed optimally. Why this happens? So what are the common risk factors? So people studied the risk factor. The two most important factor was lack of enough sinks and with running water. So in the design itself, there was a fault. Where we are supposed to wash hands, there is one sink in the corner and we have 20 beds. Who will walk? Or where the entry is at one place, but the hand wash is a different place. Who will wash? Or if there are no running water. So people have found that the two most important factors were lack of sinks and water and lack of soap, and for drying the hands, there should be some sterile paper towel or air dryer, but they are not available. Then they said that some people felt that since they're using glove, it gives protection. So glove use. Some people were that we were too busy, understaffing. And some people felt that the procedures were not risky enough to carry infection to the patients. And lastly, no proper guidelines. So whatever you look in your practice, the factors could be in one of them. So why it is important to know these factors? Because to ensure an optimum hand hygiene, you should have all of this. That is, you should have well-placed sinks with water, soap. You should have an alcohol-based hand rub at the baby side, a good product which doesn't cause skin irritation. you should ensure that gloves are not the universal precaution for preventing infections. They are just an addendum. The hand hygiene is more important. And then definitely you should educate your staff and also keep a proper guidelines so that any new team member who comes can just go through that and say that, okay, this is what the 5 moments of hand hygiene is. So how do you achieve this? To achieve that, they say one system change. They have series of steps, but the first and the foremost thing, and if you look at this document from WHO, again, a beautiful document, is the system change. And what do they say? The first step should be make sure that you have a safe, continuous water supply with soap and towels. And these are not reusable towels, they are single-use towels, sterile papers or air dryers. And at every patient care, in our case, NICU bed, you should have alcohol-based hand rub at the point of the baby's bed. Then as you proceed, you have to train your staff, and then that's what we do as a part of these, our interactions, but it's a continuous process. And then the most important thing is, after one, you should concentrate on reminders. This is very important. There should be some cognitive aids. Cognitive is nothing but pictures, which are there at appropriate places to remind that, look, this is how we have to maintain the hand hygiene, or these are the 5 moments of hand hygiene. So what is the first point of contact in the NICU? This is how the entry looks. So as I was talking about, the biggest roadblock or biggest barrier to the hand hygiene is you have problem that you don't have a properly designed sink. So look at this picture, which shows you that how this sink is located at the entry. There you see that there is a provision of elbow operated taps. There are soap dispensers, and there is one manual soap dispenser. Anything, it need not be like this, but any soap, any provision whereby you can have a soap dispenser. And you see this sink is having a depth such that the water doesn't splash. The water which falls in this gets collected at one corner, and the faucet of that is located in one corner. So there should be no splashing of water. It should be user friendly. I open the tap and water splashes. How will I use? So it should be ensured that it is a properly designed, located right at the entry of the NICU with provision for soap dispenser. There is a timer which tells me that I have to perform the hand wash for 1 minute. And how to perform the hand wash, I have a picture here. These are freely downloadable and available from WHO, and I can also share later on in the group. And these are the 5 moments of hand hygiene. So the first step is provision for the facilities, well designed, and reminding them that how the hand hygiene to be done. Elbow operated taps are preferred, and they should be available, and there should be liquid soap. One should avoid soap bars. Why soap bars should be avoided? Because the undersurface of the soap might be carrying the infection as the water collects. So medicated, non-medicated doesn't make difference, but it should preferably a liquid soap. Okay. So what does hand hygiene help? So one simple thing is, amongst the newborn, survival increased when simple hand washing was performed by almost 50%. And then definitely any setting, hospital acquired infections are decreased by 1/3. But unfortunately, at any point of time, only 40% of healthcare workers will perform this hand hygiene. And this is where we have to ensure that we bring in the culture by proper provision of hand wash facilities. Then for the proper hand hygiene, we talked about that we require a liquid soap, but the most important agent is a water. So water should be such that which is available in the taps for the hand wash should be fit for drinking. If water itself is contaminated, then definitely infections will keep spreading. So you should have an adequately treated water, and the most common culprit is the water storage tanks. So one should ensure that they are periodically cleaned. But running water should be made available in the sinks and the basins. Now, hand hygiene will work when you have definitely other measures that we screen the visitors and the healthcare workers for the signs of the infection. Definitely any individual with active infections like cough, cold, skin infections should not be in direct patient area air. The other common thing is use of gowns. Now, in many places, you will see that gowns are worn at the entry or to the infant care area of the NICU, but one should be careful that gowns can be problem source, especially if they are used repeatedly. One gown is used by different people, because there is definite chance of them getting infected. So if you are using gown, when should we use? When the parents or the attendants or the caregivers have soiled clothes and you're worried on the hygiene, yes, gowns do have a role, but they should be single use, and at the end of use, they should be going for a wash. Then, whenever there is a potentially contaminating solution, like a situation like contact and droplet spread in the COVID era, you would have all encountered COVID patient spread. Definitely, they use disposable gowns of appropriate setting. And whenever there is some soiling expected, so the gowns for the healthcare personnel, definitely it's a universal precaution before doing invasive procedures, and definitely as a part of barrier nursing to prevent infection spread. The entry to the NICU gowns for the attendants and other caregivers, it should be something which are single person. It can be reusable, but should be washed and definitely not to be shared. So gowns, if not properly taken care, could be a source of infection. What should be the dress code for the hospital care or the healthcare workers? One should ensure that whatever dress we wear, it should be bare below the elbow. So no full sleeves. From this elbow and below, definitely one should be having bare hands. Definitely denims are one common source of infection, not scientifically proven, because denims like jeans and people tend to wear and rewear. So many units we avoid saying that better to avoid denim wear. Jackets, these are the common things one should avoid. But definitely clean dress both for the healthcare workers and for the parents and the caregivers. Change of footwear at the entry. Again, yes, you can have a set of slippers. When you enter to the NICU, you change your footwear because of in our country, the dust and the dirt is more, but no need for this fancy covers for the footwear. They are all very costly. And ensure that whatever footwear is there, they are also neat and clean. So as a part of your housekeeping and house cleaning practices, we'll discuss that how the footwear also should be kept clean, but definitely change of footwear at the entry is desirable. Now we talked about the hand and the personal. We also talked at a few slides back that how it is important that the location of the NICU matters. One simple thing is anything that is spacious is always clean. Anything that is cramped is always going to be dirty. So we also see in our home that when there is nooks and corners, the dirt goes inside the sofa, inside the almirah, and never gets cleaned. Once in a while, when we remove, we see the whole bunch of dust behind that. So similarly, in NICU, it should be spacious. How much space is required? Now, this is a common question. To put it very simply, you will require for each given bed up to 150 square feet. So let us suppose if I have 12 bedded NICU, I have to make sure that it is around 1800 to 2000 SFT. And between two beds, you should ensure at least 3 to 4 feet. Definitely farther the better. But if it is very nearby, definitely there will be cross infection. So the space and the location matters. Location I told you earlier, equally important is that it should have enough space. Then we talked that we should have a hand wash area. This is again in the infrastructure at the entry with running water. We also said that within, whereas at the entry to the NICU, you have something called as a sink, which is quite big. And within the NICU, you can have small wash basins, which again should have a running water, which should be sort of fit for drinking quality, and definitely with elbow operated taps. And equally important is that they should be located conveniently such that you cover after every 6 to 8 beds, you have one hand washing area facility. So the people need not walk all the way from one corner to the other corner. Air supply. Now, anything that is well ventilated and well lighted, the bacteria don't grow. Bacteria always grow when there is darkness, when there is lot of humidity and poor ventilation. Yes, if you have facility for the what you call as air exchanges, you can definitely target at 6 air exchanges. But in most of the NICUs, when you have a simple air conditioner, ensure that it is periodically cleaned. There are filters, very simple. You just remove the upper cabinet, there is a filter. There's a lot of dirt and dust. So periodic AMC should be done and ensure that the air filters are cleaned. There are certain settings, and in this COVID pandemic, most of us had to face where we had to have strict airborne infection isolation. Now, not very common. There are only few conditions in the neonatal where you require this. But if anybody is dealing with conditions of airborne infection transmission, like COVID is a typical example of that, you have to ensure that there is a negative isolation. That is, that particular area doesn't have the air then goes out. Otherwise, the air can circulate with 6 air exchangers entering in an AC. Definitely, we should ensure that there is filtered air, the air filters are kept periodically cleaned. There should be enough provision for natural daylight to come to the NICU. One can, I mean, again, going slightly beyond the topic, if you have a good well-lit area, not only it helps the people to work there, but also helps. Sunlight is a natural disinfectant, if I have to say. The proper sunlight should be wherever the provision is there. So these things go a long way in ensuring that our environment, immediate environment, is also clean. So that's what I was discussing, that you should have a location and design. Very important that you have clean and dirty utility storage areas separate, because this is where the most of the problem comes. Ensure that you have staff restroom, the toiletries, the change areas, there is enough space for waiting areas, so that the cross contamination decreases. Similarly, ensure that you have unmarked area for the milk expression, and more importantly, staff your NICU adequately, because wherever there is a sick baby, you will always require one baby, one nursing staff for one baby, or at least for every 2 sick babies, one. But if I have one nursing staff taking care, or one of the caregiver for the babies, for one baby, there are one staff, there are more number of babies taken care. It's a human factor. You will get fatigue. Definitely, there will be breach of practices, and there is a chance of spread of infection. So these are the underlying important aspects. Just one quick example I wanted to highlight. Look, you can all look at your NICU and say that, are we following a sequential thing? Now, this was an NICU, which or a schematic diagram is shown here, that this is the entry area, this is the entry to the NICU, and the hand wash area was at one corner. So when people were entering, they would again have to go back here. This was not convenient. So if the same thing in the same space have to be rearranged, what we do, we bring the hand wash area just at the entry, so that it becomes more easy. So I can talk on this design separately, but aim is that you should have a sequential arrangement for your NICU. Like when they enter, there should be some area for provision for the lockers, you footwear change, then you wash your hands, provision for hand dry, then you enter. So like this, if you require the gowning, and then the NICU, within the NICU, the mother's expression area. So you see, everything is enmarked here, and that is what is important. So look back that sometimes the lack of proper hand hygiene just be because the way it is designed or way it is located. Okay. So that was the basic about the hand hygiene, the NICU design, and now we will just quickly move to what are the care practices. I might be overshooting the time, but I will try to be within time in the next few slides. Okay, so what happens now? Let us see, we have a baby who is just delivered, and let us talk about a case scenario of baby of M, who is a 35-weeker, 1.8 kilos, and is delivered to the mother with some medical problem and requires NICU admission. Now this baby, right from NICU admission to the discharge, is at risk. The first risk for infection starts at birth itself in the hospital. So the most important aspect is to keep strict asepsis during the neonatal resuscitation. So wherever is your neonatal resuscitation corner, ensure again that you have a provision for hand hygiene, whether it is at the labor room associated or in your OT complex. Ensure that you have provision for hand hygiene, what you just discussed. There should be proper cleaning and regular disinfection, again a part of housekeeping. Ensure that the team members wear a proper PPE. That is, they should have the, whenever they're attempting the resuscitation, cap and the mask should be there. So what is important is strict hand hygiene before attending the delivery, ensuring proper PPE by the caregivers. It depends, like having the cap and the mask and the non-sterile gloves. If you're doing an invasive procedure, definitely the sterile gloves. Cleaning the eyes, especially with the sterile gauze separately for each eye. Avoid routine suctioning of the mouth. So immediately after the delivery, and don't make it a practice. Every time routine suctioning is not required. Try to keep the cord dry right throughout the hospital stay, but immediately at the birth, the important concept is the clean cord cut and the clean cord tie, and ensure that you facilitate breast crawl wherever possible. In all the babies who are stable, allow the mother and the baby to be together. And this establishes the warm chain and the breastfeeding, which goes in a long way to prevent the infection. Then the same baby as travels, the first of the portal for the entry of the bacteria is the skin. So we have to ensure that the baby's umbilical stump and the cord are always kept dry. No need to apply anything. In settings where there is lot of umbilical infection, people have used fluorexidine, but as a routine, you need not apply anything. Dry is sufficient. The other important area is the skin of the nappy area, where frequent passage of stool, the skin becomes very soft, and the skin breach happens. So keep the skin in the nappy area healthy. Frequent change of nappies and let it air dry is important. And whenever there is a nappy rash, use an emollient cream or an oil. No bathing in the hospital setting. Immediately after birth, especially, don't be in a hurry to remove the entire vernix caseosa or that whitish thing on the baby's skin, which is nothing but a natural emollient. Let it be. Just wipe out the blood. Definitely no bathing with soap and water throughout the hospital setting. Only sponging. And definitely you should ensure that for all the low birth weight babies, and especially very low birth weight and low birth weight, you do oil massage with skin. Oil provides a natural barrier on the skin. It not only helps in decreasing the fluid loss, but also keeps a natural barrier, the skin intact. So this is the skin and the cord care when we come to the baby care practices. Now the baby comes to the NICU and gets admitted. The sick neonate, as we discussed in the risk factors, you perform more invasive procedures, there is more chances of infection. So how to set up the baby bed? Again, we have a skill video. We can see it if the time permits. But the most important concept, again, as I said, is your bed should be such designed that there should be provision for alcohol hand rub for the hand hygiene. And the articles like stethoscope and thermometer should be individually dedicated. This stethoscope is for this bed and this baby. It should not go to the another baby. So this is very, very important. And wherever possible, if you can avoid invasive procedures, it's always the bed, because invasive means whether you put an ET tube or a IV cannula. Think there are the clinical indications which I cannot cover here, but to put it very simply, you try to minimize that. Now, I will spend just a couple of minutes on the bloodstream infection. Now, bloodstream infection is nothing but the bacteria which landed on the baby goes into the baby through a IV cannula. What normally happens is that we said that the baby's skin might be carrying the bacteria. The hands which are there from the healthcare givers contaminate this side. And the bacteria which is there then contaminates the catheter hub. So just at the end of the cannula or the UV line or the UVC or the PICC line, you have the connector. So the bacteria start growing along this and they can contaminate the hub, and from there they can enter the bloodstream. So most commonly, it is the skin organisms and the flora from the hands of the healthcare givers which leads to bacteria to enter into the bloodstream from this IV device. And in very, very less number of cases, it could be contamination of the IV fluids. So in this study, which was done good 15, 16 years back, they showed that out of 100 infections, majority of infections, that is 70% of time, it is from the skin contamination and the hub contamination, and very rarely through the IV fluid contamination. So that is why it is important that we perform hand hygiene and also keep this hub clean. And how to do it is what we will see. So the best way to prevent these bloodstream infection is whenever you are putting an IV line or a PICC line or the central line, you should have hand hygiene before the procedure. When certain evidence-based measures are all clubbed together, it is called as evidence-based bundle care. That is nothing but individually evidence is there that they are all good practices. When you club all of them together, the impact increases. So this is called as bundle care. So whenever you are going to put an IV line, you should ensure that all the things are put together. What are they? You use hand hygiene. You have checklist. What is checklist? That before starting the procedure, you will say that I will require this cannula, I will require skin asepsis, I will require spirit swab, I will require gloves, I will require dressing. Everything you check on the checklist and assemble it and ensure that you follow that, and not only assembly, then the subsequent steps. So such checklists go a long way to ensure that we are adhering to the procedure safety. So you can practice that. Procedure cart, you can assemble everything and just get that cart or that bin to the baby, and you can have everything already pre-ready there. Universal precaution of cap, mask and gown before the invasive procedure must, and something called as aseptic non-touch technique, which I will show in the subsequent slide. These all practiced together during insertion of the IV device or IV line, it decreases the risk of infection. Then once the line is in place, you should ensure that Every shift, we check the IV line dressing for any redness and make sure that if any soiling, the dressing is changed. Wherever there is a connection of the port and the IV fluid line, whenever it is touched for any reason disconnected and connected, it should be cleaned with a spirit swab. That is called as scrub the hub. The IV tubing should be changed every 48 hours, and every day you assess whether you need an IV line or the central line. Many a times we are giving unnecessarily, then take it off. If the baby is on full feeds, why will you require? So every day you discuss in the rounds with the staff members and amongst in your huddle that whether you require that line. So this is again the 4 important things during maintaining the line. So one is for insertion and one is for maintaining the line. So this all put together is called the bundle care. If you practice them together, the infection risk decreases. So this is one checklist. Again, I will share it individually. Sorry for the poor quality, but it just shows that what are the equipments required, what is the, how do you clean the site, and how to proceed. So this all thing you can prepare and keep it in a single list is called checklist, both for insertion and the maintenance. So this brings us to the most important concept, is called as aseptic non-touch technique. So whenever you perform a procedure, you should ensure that we follow the principles of ANTT. Now, if you go to the website antt.org, it is a it's a very easy to understand message from this organization of ANTT. But what it basically says is that for every procedure, you have to identify key part and key site. Let us suppose if I'm trying to put the cannula here, this is the key site, and the cannula needle will be the key part. So both the key part and the key site should be sterile and or should be not be contaminated. How to do this? I will show in the next slide. That if you see in this poster, there are a series of steps. So what does the personnel do? First, they perform the hand hygiene. Then they take a tray, disinfect the tray with spirit, assemble all the things required. Again, they perform the alcohol-based hand rub, hand hygiene. Then they prepare the IV cannula. Then they disinfect the skin. And once they disinfect the skin, this 12th and 13th step, they ensure that the needle is directly being, the IV cannula is directly put into the vein. Just after disinfecting the skin, again they do not palpate it. So neither the cannula tip touches any surrounding. So this is key part and this is key site. And again, we have a skill video for that, which is easy to understand. And this entire procedure ends after discarding the waste and also decontaminating the equipment tray and again washing the hands. So when you perform all these things together, it is called as the ANTT bundle. And this applies for everything, for venipuncture, for IV cannula, for putting endotracheal tube, and easy such posters are available. So please practice ANTT for every procedure. Then whenever you are putting an IV line, you have to disinfect the skin. So we can use it with alcohol and povidone iodine or alcohol plus chlorhexidine agents. Now in extremely small babies, there's a theoretical risk that iodine gets absorbed from the skin and can suppress the thyroid gland, but it is something which is more easily available. So whenever you're using alcohol, povidone, iodine, ensure that alcohol followed by iodine, and iodine is thoroughly cleaned again with the alcohol. Alcohol plus chlorhexidine preparations for cleaning the skin. The concentration as recommended is not universally available in India, but the routine hand rub which we use, some people use to disinfect the skin, but chlorhexidine alcohol can also cause dermatitis. So not suitable in very small babies. So to summarize, before collecting culture and for surgical procedures, always alcohol plus povidone iodine. For other settings, it can be plain alcohol with or without the chlorhexidine. But proper skin asepsis before the invasive procedure like cannula is very important. And again, one can go through number of such videos which are available. The other important thing is in a part of the skin is how you take care of the skin who is admitted to the NICU. You just see here that we are using this transparent, in this baby, this transparent semi-permeable dressings are used to fix the probe. This is called as Dermadew and this is the Tegaderm. Most of you would be using this. These are breathable circuits that they keep the underlying skin soft. If you use those cloth plasters, the underlying skin gets damaged. Second thing, all the dressings have strong adhesive. So whenever you try to remove the adhesive, the upper skin layers get breached. So you should ensure that you first soak that area with sterile water for a few minutes and then start removing the adhesive. Otherwise, the skin gets damaged. So the proper skin care includes doing a good oil massage, ensuring that you use a semi-permeable dressings, especially to fix the catheters and the cannulas. Then it is very important again that we have strict asepsis during IV fluid and injection preparation. And most of the time you will require 2 people to prepare an IV infusate. You require somebody to help you to put all these disposable devices. So you should be doing it in an area separate from the patient care area. And that area should be disinfected. Preferably it can be like, here they have spread a sterile cloth and they have assembled everything here and then they are preparing. And see that how the asepsis is maintained. This surface from where the person is drawing is first cleaned, or once you remove this, you just clean it with a spirit valve and then you draw from this. And both the people have performed hand hygiene and they are wearing sterile gloves in this case. And after preparing, they are not carrying in bare hands. They are again carrying in a tray with, in this case, they have used sterile, but in just the sterile cloth, or it could be a clean disinfected tray also. So from the point of preparation to setting up, you should ensure that asepsis is there. How to do? Again, you have skill videos. But one important point is never ever keep stock solution. That is, I draw 10 ml in the morning and again I use it in the evening. No, that will not. You have to find ways that you avoid stock solution. Similarly, this needle inserted into the bottle and that is kept like this, it is not a good practice. So no stock solutions is very important. And these IV lines which you have, preferably you can change every 48 to 72 hours. CDC, there is one of the organization recommends every 48 hours. Then we just discussed something called as barrier nursing. I will not go much into it, but this is something which people think about when there's an airborne transmission, especially in COVID areas. So we have to take proper PPE, but it's again important to prevent infection. Now, after the bloodstream infection, you have the airborne transmission and you have the VAP. So what is VAP? VAP is nothing but whenever a baby is on a respiratory support, you can have infection into the baby's lungs leading to pneumonia. So this happens because of the device which you are using, like an endotracheal tube, and the practices. What are they? So whenever you are putting the baby on some respiratory support device, ensure that that particular device is clean, like a simple oxygen cannula. It should be, when I say the mask, not the oxygen cannula, let us suppose you are performing a PPV, or let us suppose you are giving a TP's breathing support. The mask should be disinfected. The ambu bag should not be reused. After using for one patient, it should be definitely disinfected for the next patient. So that is the first thing, what respiratory equipment you are using. In certain cases, the circuits and other things, definitely they should be sterilized. No reuse of these sterilized circuits which you are for setting up CPAP and ventilator. Definitely hand hygiene is again important. And invasive procedures like intubation and setting up circuit, you should use sterile gloves. Similarly, for procedures like surfactant administration. Then the care practices of endotracheal intubation and suctioning which you do, you should practice ANTT. And again, there are skill videos. Maybe for the want of time, I might not show that, but I will share the link with you. Then when you're ventilating the baby, ensure that the baby's head end is slightly elevated and always the ET tube is parallel. So that is because if the ET tube is vertical, all the humidity, all the fluid that is accumulated then goes into the ET tube. Similarly, in a baby on respiratory support, ensure that the oral hygiene is maintained. Oral coating with expressed breast milk, avoiding bulb suctions for the mouth suction, and using separate mouth and ET suction, always suctioning mouth first followed by the ET tube. So these are certain bundle of care practices which again we have to put together to prevent. So this is what I meant, that you see this baby on this respiratory support, the single most important thing is proper humidification, and we are using sterile water here with autofill. We don't frequently open this port and pour water. It should be a closed system like this. You just put it like an IV fluid and the sterile water keeps filling this chamber. It's called as autofill system. So to prevent the pneumonia of the ventilation, always make sure that wherever prefer you avoid invasive ventilation. Then you perform whatever respiratory equipment is used, either they should be sterilized like the ET tubes, and no reuse of such equipments. And whatever is coming in contact with the baby like ambu bag, they should be disinfected, and definitely between two baby use they should be sterilized or disinfected. Then you should give proper humidification, and for that you should always use sterile water with autofill. And whenever you are performing suctioning like for ET tube or oral suction, strict ANTT should be followed, which I will show you in the skill video. So with this, the same baby who was admitted definitely is stabilized, so should be then started on feeding. Breast milk is the first vaccine, all of us know. So breast milk not only decreases sepsis and NEC, but also helps in the long-term benefit. So at the earliest, facilitate mother's own milk and start the baby whenever medically indicated. So most of the low birth weight babies and very low birth weight, more than 1200 grams, they can be on oral feeds right from day one. In a sick baby and infants who are very small, maybe you start with small amounts of trophic feeding, but start on feeding and use a protocolized system in the NICU. Definitely there is a role of use of probiotics in decreasing the infection, which is beyond the scope of today's talk, but just I'm highlighting on that. How you store the milk is equally important, and you should ensure that wherever possible, you don't breach the storage conditions. Like at room air, you can keep the express breast milk close to 3 to 4 hours, and definitely you should ensure that there is strict hand hygiene during preparing the feed also. And again, there are skill videos, but I'm just telling that how it is important. And if you're using a stored express breast milk, ensure that you take out from the fridge and again do not keep it back. That repeated warming and freezing is always dangerous. To support everything, you require KMC, and the previous webinar you always learned, you learned already that it decreases infection, hypothermia, but very simply, once you have KMC as a bundle of care, it decreases the need for interventions and stay, and thereby decrease the infection. So at the earliest, wherever the baby is, whenever it is possible, initiate the KMC. Then comes the concept of family-centered care. In our very own India from Delhi, Dr. Aarti Maria and the team had done beautifully this study. What it is shown is that when you get the parents in most of the caregiving practices, not in, let us suppose, IV cannula or the setting up of fluids and injections, but routine care practices like changing nappy, doing oil massage, it improves the baby care and decreases the infection, because here that mother or the father is taking care of that baby only. They are not going to go to the next baby. So it has been proven feasible, well accepted. You have to just inculcate in our practice. At least some practices can be delegated, so they become partner in your care. So the family-centered care is something which we all should think and find way that how we can get the mother and the father in the baby care practices. Obviously, we have to educate them. That is the most important. And they are not qualified and trained people. We have to tell them what is the basic hygiene. So even here, the basic sanitation and hygiene is important, and the parents need to be told. Isolation, that is, let us suppose there's an infected baby. Can I keep with other baby who is not infected? Preferably an infected baby or babies with similar infection should be kept at the same place. Now, it is especially useful, but lack of space and staff can really create roadblocks for creating isolation and cohorting. But whenever there is an outbreak, you should always ensure that the similar infected babies are kept in a segregated area, and the designated staff only takes care. There is no staff movement from the infected to the non-infected area. And in cases like airborne infection, definitely you should have a strict isolation. The last point is, how do you use your antibiotics? Now, again, this is frequently missed. Usually it's a vicious circle. Once we use our antibiotics liberally for every situation and as a prophylaxis, you will end up creating microorganisms which are resistant, and these microorganisms from that baby comes to the environment, and from the environment to the next baby. So always ensure that the antibiotic usage is limited, and there are ways and methods for this, but I'm just touching upon this point. Now, infection control, the most important thing is that it is not a single point intervention. There is actually a bunch of things. To get all of them together, quality improvement or POCI, and this module is again from All India AIMS, which is available at the website of the same name, POCI. Please go through this. How to do. And each NICU should have its or own POCI to look at some targets. It could be like improving hand hygiene or decreasing bloodstream associated infection, whatever it is. Again, one should look at, because it is not a single person and single intervention. It is a team, and it's a bunch of interventions, and each place will have its own challenges. At one place, it could be an ICU design. At another place, it could be lack of running water. At third place, it could be overcrowding. At fourth place, it could be that people are not using hand rub. You identify in this POCI model by asking questions in terms of reference to the problem in the place person. So it's a definite, beautiful idea. All of you should go to the POCI website and practice this. Definitely, each one of us should be a champion. One should take lead and say that I will take care, or we will take care about infection control. Safety is a culture. So culture is something which we are all proud of, and it cannot be just achieved in one day. It's a constant endeavor. Just like our heritage is passed from one generation to another generation. Whenever the team is changing, many places will say that, look, I have a staff who is trained and now moved out to the next ward. But the new person should have method to learn that. So we should ensure that method is in place. So that is where the local champions help. Regular audits. So nothing better than audit. So every month you collect how many blood culture positives were there in your unit. What organism was there? What was their sensitivity pattern? And this could be one of the audits. The other audits could be that when I'm performing the procedure, are we following all the measures? So that you should practice. And whenever you achieve your targets, do celebrate the success and spread the message to all the team members. So I think that is what from my side at this stage.
Thank you so much, sir. Thank you so much for sharing the information. It was very informative. And I hope all the participants have been absorbing all the information that you've been sharing. Thank you for your time. And